Hello and welcome. Today we're going to talk about diastasis recti or abdominal separation. So I probably have made the same video before, but I talked to a mom's group today and this is not just from them, but sort of the theme I hear from people is I'm so afraid of diastasis recti that I just don't do any core exercises. And by that, what they mean is I'm so afraid that I'm gonna do the wrong thing and make it worse that I just don't want to do anything. So I've heard this from moms and I've heard this from athletes. And if you fall into either of those two groups, or they overlap, you need core strengthening, right? And I was thinking about this and I feel like this is our society. We go from one extreme to the other. So it was 10 years ago, we knew nothing about diastasis recti. It was not even on anyone's radar. And then fast forward to today, it's all over the internet. And I also think the internet really preys on moms because it's a vulnerable time, right? Don't do this for your baby. You're going to do this wrong for your body. You're going to make this worse. It's horrible. So as a physical therapist, I also say this to a lot of my patients. I'm I think we start these things, right? We're oh my God, diastasis recti, you got to fix it. And then we realize sort of maybe it's not that big of a deal for everyone. And so we got to find a happy medium. So hopefully it's gone from one extreme to the other and hopefully we will end up back in the middle. So let's talk about diastasis recti. So if you have been pregnant and have carried a pregnancy to full term, to the third trimester, you probably had diastasis recti. There is no way to prevent diastasis recti. So it doesn't matter what you do or don't do. That's just the adaptation of the body to grow to house a baby until the baby's ready to be born. Your muscles stretch, right? Your abdomen between your ribs and your pelvis, there's no bony structure there so that your abdomen can grow to hold the baby. So there's nothing you can do to prevent it. And most things you're going to do, it's very unlikely you're going to make it worse. So if you see what we call doming or coning, the center of the abdomen, pushing up, we don't want to repeatedly do those things. So for some of my moms, it's getting out of bed, they see that. And so it's yep, you have to get out of bed every day. So you probably can't avoid that. Maybe rolling onto your side, but some of them still see it when they roll onto their side. But let's say you're doing some exercise at the gym or fitness class and you're seeing that happen. That's a sign that's too hard for you right now. So whether you're pregnant or postpartum, you're probably not making it worse. It's just telling you that exercise is too hard for what your abdominals can do at the moment. But for my postpartum moms, who are I'm terrified of making my diastasis recti worse. I don't know what exercises to do, so I'm just not doing any core stuff. And that's not how it should be either. And I'm so annoyed that not at the moms, but at the internet, that it got to this point that people are so fearful that they're I'm not going to do any exercise. And so if you're a mom, how much does your baby weigh? How many times a day do you have to pick up your baby? If you leave the house, how many times a day do you have to pick up the car seat? Do you have to pick up the stroller? Do you have to carry the diaper bag, right? How many times do you have to pick your baby up and down to change them? All of these things require core strength. And so, you should be working your core. So that doesn't mean necessarily just going back and doing whatever. And this fitness instructor today of this group I was talking to, she was you need to do deep core. And that's, really what I teach my patients in the clinic is these deep, how to use your deep core. So let me show you this picture. So diastasis recti. So this is a normal abdomen, your six-pack abs, and then it's these six packs separate. So it's not a hole. A hole is a hernia, but it's a separation. This tissue is stretched out. It's this is connective tissue, and so it feels sort of flimsy in there. So what I feel on moms, I feel when they do a crunch, I put my finger right here on their belly and I feel like, is there a space in there between the abdominal muscles or does it feel like this? So after having a pregnancy, it's normal to have one finger width of separation. Okay, that's considered normal. The other things that I feel for, so it's pretty hard to assess yourself if you're not like exactly sure what to feel for. For some of my patients, it's really obvious. I've done this for a long time. I can see on their skin, like the way the stretch marks look if they have a separation. I can see that, and like moms kind of notice that about themselves too. It's not just stretch marks, but it's like a very like wide stretch mark, or their belly button is wide, or their belly button is deep or off center. Like that also is a clue that like maybe you have diastasis recti if your belly button doesn't look normal after pregnancy. Or if you can really feel, for some people that have a large separation, you can really feel in between and you can feel that. But a lot of people have like a minimal separation. So you're probably fine to do core exercise if you have a minimal separation. But yeah, so our muscles, there's my other picture. So, I don't know if I have my other picture. This. So our abdominal muscles have 4 layers to them. So this top layer is this 6-pack muscle, okay? And that's what separates. But underneath that, you have 2 layers of obliques. Forgot the word almost for a minute. So one layer goes this way, one layer goes that way, and then you have the deepest layer, your transverse abdominis, which goes straight across. And so rehab-wise, we work from the inside, the deep core, and then the obliques, and then the rectus abdominis, the 6-pack muscle. So we work from the inside out, building back that strength and that connection. And so the other thing I feel for when I test moms is not just like, is there a hole? Is there a separation? But like, how wide is it? How deep is it? And also we test it with like a crunch motion so I can feel the muscles activate. So if these are the 2 halves of the 6-pack, and maybe at rest it's like 3 fingers wide, but when they activate the muscles, does it get smaller or does it stay wide? So that tells us like, are the muscles doing what we want, or are they're not engaging correctly? So and then we have techniques to work on that. So I use a lot of breath, like a forced exhale. Like if you think about like blowing bubbles is not a good example, but like blowing up a balloon, like if you do that, if you feel your abs when you do that, we call it a forced exhale, you should feel your abs engaged. So that's what I'm looking for with my moms that have abdominal separation. And we start with that forced exhale, and then we add challenges on it, like crunches or like a marching motion lying down, like simple things. And then we build on that. We challenge it more and more. Yeah. So anyway, my point is, don't avoid doing exercises. So I even had a woman come to me who never had a pregnancy, and she was convinced she had a separation because she had this like funky looking thing on her abdominals, like sort of this part that poofed out, but it wasn't in the center. It wasn't the muscles, but she was like a really active weightlifter, and she's like, I just haven't done any core exercises for a year because I was convinced I had this. I didn't know how to check for it myself. And that's not good. If you want to lift heavy weights, you need to work your core. And your core is going to be worked with lifting heavy weights. But anyway, so if you're a mom, if you're into fitness or exercise, you need to work your core. But yes, start with the deep core, practice that like forced exhale. And then can you use that with other exercises? So yeah, maybe for you, it's not doing 100 crunches or 100 sit-ups, or for some people, planks are really hard to start with, but find some exercises. Maybe I need to make a Diastasis Recti rehab video series. Yeah, so anyway, my point is don't totally avoid it, but also like watch for this doming or coning. So if you see that, that's like too much. do an easier exercise. But if you don't see that, you're probably fine, even if you have a separation. Like the only way it heals is by doing core exercises and strengthening. It doesn't heal by avoiding doing it. And it's never too late. You know, I had a mom in my clinic recently. Her youngest is 10, and she did have a little bit of separation, like not a huge amount, but it got better. And for her, her main reason she came in was bladder leakage. And I think there's a connection of if this is weak, right? Like your pelvic floor is part of your core. So if there's some like weakness here, it's probably going to translate to weakness of your pelvic floor too. So I don't know what the right amount is of like, don't worry about it versus worry about it. But I think right now in society, we're way too worried about it and we're avoiding everything. So see a pelvic floor therapist if you can. You know, even virtually, it's maybe not the most ideal, but we can work on this. Like a lot of, you know, I test by feeling, but a lot of it I can see. And then I really just watch my moms, my women, as they're doing their core exercises to make sure they're engaging properly. And I watch for the subtle little like poofing up. And if it is, that's too much, right? And then we go from there. So there's help. And then once you learn how to engage the core properly, then you can go on and do whatever. But this avoiding it is that's not what we want to do either. So I'm sorry there's like so much fear out there. And hopefully we can come back to the middle, restore the middle, and not be like so one extreme or the other of like, don't worry about it, or like everyone needs to worry about it, and find like a happy medium of like, if you have a large separation, you need to get help. If you have a small one, probably don't need to worry about it, stress about it too much. Okay, see you next time.